I'm very open about my story. I have prostate cancer, diagnosis, surgery, whole thing, been through it all. And I'm grateful and lucky to be on the other side. But prostate cancer is an interesting disease. You still kind of play a little whack-a-mole with it. There are many options out there for treatments that men simply may not know about. Prostate cancer is the most common cancer in men worldwide. We went to Austin, Texas to learn about a non-invasive treatment that's giving patients a different look at their future.
So I started running in college to get my dog some exercise, and it became something that brought me a lot of joy. The last 3 years, my PSA levels rose. I had a biopsy, and it was positive. Not a surprise, family history. My brother had surgery, as did my uncle, and so I thought that that was how most people dealt with their cancer. Come to find out through a couple of running buddies who had radiation that there was another option. My urologist recommended that I investigate Focal One for the HIFU procedure. I think the thing that was great was that it was so quick. It's non-invasive, there was no cutting and no radiation. It was just a one-day thing. For anybody who's recently diagnosed with prostate cancer, I would tell them to make sure that they were aware of all options. And then I let them know that there are other ways to combat prostate cancer rather than just radiation and surgery. I don't usually let much slow me down, and so after I had the procedure, I found that I was able to get out and do whatever I wanted to do.
I'm joined now by Peter Dolan, whose story we just heard, and urologist Eric Giesler. Thank you guys for being here so much. Peter, thank you for sharing your story. I'm going to talk to the doctor first, okay? So tell us about the treatment and where it fits in the spectrum of options for patients.
Yes, I think prostate cancer is really one of the most common cancers we see in men, and it's a very heterogeneous cancer. And I think we sort of underestimated the prostate, and now we have so many better diagnostics.
I want to stop you.
Oh, sorry.
I want to make sure people understand what you're saying, because there's a lot packed into that.
Right.
Prostate cancer is brilliant. It's a super smart tumor, and
Right.
it's not a cancer. It's kind of multiple diseases.
Correct.
Right, and so you need different approaches.
Right, exactly, and it's traditionally been an all or none, but now with better testing and screening, we can catch it earlier, so now we can be more precise on treating patients and sparing them some of the side effects we've traditionally had in therapies.
Right, and of course, men worry about urinary retention,
And sexual side effects.
Sexual side effects, which I've had none. The robotic prostatectomy was a major advance forward, but it's a big surgery.
It is.
You want to avoid that if you can. I'm sure they talked about that with you.
Absolutely.
And is it for low-grade tumors only?
No, it's for intermediate, low grade, and in some cases high grade, but mostly for intermediate and
So up to
grade
4+4 Gleason scale, up in there?
Depends on the situation, mainly more 3-4,
3-4, okay, so intermediate low.
Yeah.
And I'm imagining, because tumor can occur throughout the gland, and it can be multifocal too.
Exactly.
So you want to know for sure you've got just one foci.
Right.
And how do you do this? What do you go
Well,
after?
you know, with today, most men, before they even have a biopsy, have MRIs. The MRI gives us a precise direction of where the tumor is. And I think that's what's been historically the difficult part. We've always underestimated the biopsy. You know, I always think about the prostate like your face. You have millions of glands all over, and you just see one. But in prostate, we're scared we're missing it. But now with MRI, we get focus, and then we can be
PSMA
certain.
scans too now. You can
PSMA scans are,
PADs
and that's been a game changer for a lot of men to really define where that tumor is.
Yeah.
And so we really be certain where we treat, we're getting all the cancer, but leaving the rest of the healthy tissue alone.
And how do you go after it? What is the procedure?
So HIFU is using highly intense focused ultrasound. I always think about sunlight, a magnifying glass, and a piece of paper. You know, but instead of sunlight, you're using ultrasound, very focused on an area to disrupt and destroy that tissue. So when that person comes out of the operating room, that cancer is dead.
There's no cutting though, right?
There is no cutting. It's a completely non-invasive surgery.
So Peter, how was that procedure?
From my perspective, it was the way to go. I looked at a number of options. I've been in a running group for 30 years, and so as my friends have gotten older and gone through this, they've had different ways to solve their problems. And for me, none of them had this opportunity. So I had to really look at it and decide if it was something I wanted to do, but I highly recommend it.
So prostate cancer usually occurs in one lobe or the other. Mine was central. Could you do a central tumor?
You can, and actually that's where his was.
Oh, interesting.
And it was not in a traditional space, and that's actually the MRI did not pick it up. It was only through the biopsy that we were able to found it.
So you went in, you had it done. I bet it got you back out running again pretty quick.
Absolutely, within a week or two.
Oh my goodness. See, I was not me. I had a big surgery. It's a big surgery. Let's just talk about PSA testing. What do we? I was lecturing the audience during the breaks about this. How do we get men to do more PSA screening?
I think we just have to be advocates for ourselves as men. You know, I think men have traditionally been scared of going to doctor. We're all sort of scared, but owning your body and not being scared, because we have so many new advances in ways. And PSA is just a starting point. And there's so many new tests that you could do, MRIs, to really get more precision before we go right to an invasive kind of procedure.
The men, because I'm in primary care, the men always go, I'm fine down there.
Right.
You wouldn't know. We have to scream. You didn't know you had anything. I didn't know I had anything.
No symptoms.
Yeah, nothing. Because they imagine that you're going to mess everything up with the treatment of the cancer. You're here to tell us you're fine.
Exactly.
I'm here to tell you the same. So whatever your choice of treatment is.
I think I want to make that clear. There is no age limit to screening for prostate cancer.
Thank you.
Medicare covers it once a year. I always tell people, as long as you're active, as long as you're doing things, and until that day comes when you're waking up, watching TV and eating Cheerios, you should really check that PSA. We have a spectrum of treatment options.
Yes.
And early detection, early diagnosis, as in Peter's case, really enables a person to get really a non-invasive focal treatment to minimize impact on quality of life. You want to get a short-term, cure, but with not having lasting long-term side effects. And that's what Focal One HIFU allows us to do.
And to some extent, the age of the patient figures into what you're going to choose,
Correct.
this sort of thing. So, well, thanks, gentlemen. Peter, thank you for sharing the story with us. I share mine all the time. I think you're one of those guys too.
Absolutely.
We don't want men to miss this.
Right.
It's just ridiculous. The earlier you know, the more options you have and the better the outcomes. To learn more about Focal One or to find a physician offering this treatment, very simple, go to focalone.com. After the break, we're talking small molecules with huge impact. Stick around. Good. That's really good. Thank you.
Thanks for the opportunity.
Yeah, I was 50 when I was diagnosed. I went on active surveillance for a while.
Yeah.